Hi, welcome to this virtual event. I'm Dr. Michelle Dion, Associate Professor of Political Science and the Academic Director of CRESS, the Center for Research in Empirical Social Sciences at McMaster University. I am very excited today to welcome Dr. Fei Yu. She's an assistant professor at the UNC School of Information and Library Sciences, and also a health technology and informatics librarian at the UNC Health Sciences Library. Her research interests include electronic health records, user interface design and evaluation, data analytics and visualization, clinical care research, digital health, and research impact metrics. We're very excited to have her with us today to talk about bibliometrics for research assessment and quick insights. Thank you, Dr. Yu, and I hand it over to you now.
Great. Thank you so much, Michelle and Cheryl, for inviting me to be here today and share with you one of my favorite subjects, bibliometrics. And particularly today, I would like to focus on how to use bibliometrics for research assessment and quick insights. So here is the outline for my talk. I will start to explain what bibliometrics is. And this is a research methods I think everybody should know. And then I will show you some examples, what you can do with bibliometrics. You probably know how to, you probably want to, after I finish the examples, you probably want to know how to get started. So I will introduce some resources, tools, and the normal process I usually take, and some caveats that you should watch. And then last, I will briefly mention how to explain bibliometric results. I will leave time for Q&A. So what is bibliometrics? Is this the first time you heard this term? Actually, bibliometrics is a very well-known method in library and information science. And now it's gradually increased, being used by researchers across multiple disciplines. And this term, bibliometrics, was first coined by a researcher, Pritchard, in his article published in 1969. And the title is Statistical Bibliography or Bibliometrics. This article was published in Journal of Documentation. And I have a slide for all the references, so you will know the information. And most of the time, when we use this term bibliometrics, we refer to the methods that utilize the quantitative and statistical approach to study various aspects of a chosen pool of publications. So bibliometrics, this method is applied mostly to study publications. However, in recent years, including me, many researchers have started to use bibliometrics to study grants, to study patents. I have an example using my own publication, and it will show you later. So when you look at the term quantitative and statistical, you might wonder, can I use statistical software for bibliometric analysis? The answer is yes, absolutely yes. Like I used Tableau, SPSS, even SAS to help with my bibliometric analysis. This is an example of a citation record. Some of you, I heard that this talk is for graduate students. So you may think why I need to study publications. I have to say, you actually study publications almost every day, thinking about the paper that you have written. And at the end of the paper, usually you create a reference bibliography like this. And in this example, I used the paper that I published, I co-authored with Alison Van, and she is now working at your university. This project we conducted together while she was at UNC. And the first component of a citation record is author. So this paper was co-authored. I'm the leading author and Van is the second author. We have a group of other authors at UNC. By analyzing co-authors, we can know who collaborate with who. You may wonder why I want to know that. Not only you want to know who, you may be interested in knowing who collaborate with who. Most important thing, you want to know who participate in this research activity. So it's important to count the citation output associated with individual researcher, right? You want to see Fei Yu, how many publications she has had in this field. Then you can use the author name for analysis. Second, year, 2020. This was a very recent article. For a group of publications, you may want to know this group of publications, they are about one topic. You may want to know the distribution of research output over the years. So which year people publish the most in this area and which year the least. And then title. Title is an excellent metadata of a publication because it reveals the topic of this research activity. When I do topic mapping and topic analysis, I usually use title and sometimes use title and abstract together and create a research landscape visualization, quickly show people what are the major topics covered in this group of publications. And then source title. This paper was published in Journal of Clinical and Translational Science. This is the source title where we got published. So for a group of publications, you might want to know where are those publications are published on. If I write a very similar topic manuscript, I may want to submit to a journal like this. So it can help you actually decide where to submit your manuscript. And the last is the DOI number. Nowadays, for modern publication, for modern publishing, every publication will be automatically assigned a DOI number. This is a unique identifier of a document, and you can use it to retrieve this document very quickly in citation databases or just Google and using the DOI number. And next, I would like to show you an example of a citation record, how it looks like in a citation tracking database. And this is an example of a citation record, how it looks in Scopus. When I was preparing for my presentation, I purposely went to your university library website and look at the resources you have. Yes, you do have Scopus. And Scopus is an intelligent citation tracking database offered by Elsevier. You may already know the big fight of University of California system with Elsevier. That's another story. Anyway, Elsevier is the largest publishing company in the world, and they have offered many research databases, and Scopus is one of them. Luckily, your university has it, so you should use it. Otherwise, it's a waste of valuable resources. So this is another example of my publication. For this one, towards a better understanding of test demands, workload, and performance during physician-computer interaction, I co-authored with a group of researchers at the UNC School of Medicine. And on this record, you can see journal source title and title of the document, a co-author name, and affiliation. And the most importantly, you can immediately import all those metadata associated with the citation records to your desktop. So I put another screenshot of how to export those metadata to your desktop, that screenshot on top of the citation records. So you should be able to see there are different fields of information you can export. You can export the citation information like authors, author names, author ID. By the way, author ID is the ID that the Scopus database assigned to each author. You probably don't want to have it. But it can be important when you want to specify one specific authors, especially these authors have different names, before married or after married, the name change. And a unique author identifier can be the key to identify all the relevant publications associated with this researcher. And the year and the source title, I would like you to look at the bibliographic information, this category. The most time I will check that affiliation, this box, because this affiliation fields you can download to analyze the institutional collaboration. UNC collaborated with another university. your McMaster University collaborated with other universities. And all those research collaboration data analysis, you can use this affiliation fields. And if you want to do a topic mapping, you may want to check the abstract or author keywords. If you want to add additional layer of analysis by including grants data, Scopus also provide funding information. So you can check their funding details. When we publish a paper, we usually add an acknowledgement. We put the funding which supported this research activity at the end. So that's how the funding information is extracted and provided to you as the downloading fields. So after you selected all the metadata fields that you're interested in analyzing, you can click that export. Okay, now you have exported data. What can you do with Bibliometrics? I outline 3 things you can do. First of all, research influence. You may think, what is research influence? It sounds very abstract. Let's think about this way. When you do in academia, research enterprise, we do research every day. So when we do research, we cannot do research, out from nowhere. We always, based on our research methods and research fundings, based on previous existing publications and research efforts, we build our new methods based on previous methods. We build our own research based on previous existing evidence. So that's why we need to cite other people's work, which influenced us. This citing behavior is a kind of impact or influence. So in academia, when we say research influence, usually we look at the citation impact, which means that if you cite someone and this someone's work have certain influence over you, by counting how many times your publication has been cited, you can get an idea how your work has influenced others. So in Bibliometrics, we use the citation counts as an indicator for research influence. Last year, when I submitted my annual performance review, I need to demonstrate over years how my work, my publications has been cited by others, the citation counts. There are different ways for a citation tracking database to provide citation counts. They are straight citation counts, just count how many times your work has been mentioned and put into the bibliography or references of other publications. And nowadays, there are better citation indicators. They are called comparative citation ratio, because we know citations need time to accrue. New publications always have less citation counts compared with older publications. So citation tracking industry, actually, I can say is industry. They develop some relatively new indicators called comparative citation ratio, which compare publications with other publications published in relatively the same time in the same field, because we know some publications in certain fields, they are cited less than publications in other fields. And also similar document type. Review articles, if you write a systematic review articles always receive more citation counts than normal research publications. So you need to compare apple to apples. So for research influence, I will have an example to show you how to use relative citation ratio to provide an objective view of your research influence. You can use it to evaluate individual researchers' publication influence. You can also use it to evaluate an institutional influence. An institution has many researchers in it. So aggregate all the researchers' publications and count the citation influence. You can showcase how the performance of the institution is. I did a study 2 years ago for our UNC School for Public Health, which is highly ranked in the nation, in the United States. So I aggregated all their faculties' publications in the recent 5 years, and then retrieved their relative citation ratio, comparative citation ratio, and find that their citation influence is way above the average of research publications in their field published in most recent 5 years. So this is we submitted this report to the administrator of UNC School of Public Health, and they are very happy to see that. Second, research collaboration. Research collaboration is the key nowadays for grants application. Especially at UNC, they have a lot of local collaborated grants application efforts. So for local universities to collaborate together, they want to show some pre-existing research collaboration in publications. So I conducted the co-authorship analysis for them by extracting researchers from each different universities to showcase how many they have collaborated locally together. So they can put in the grants, strengthen their argument, and have better chance to get funded. And last, research landscape. By analyzing title and abstract, I used Bibliometric network analysis tools, their text mining function inside these tools, so that I can use to analyze, to visualize actually how many different topics, major topics, has been touched, has been addressed by this group of publications. So next, I would like to briefly show you some examples. And on the left, this line chart. This is a publication I had in 2018 based on a project I did in 2017. It's an evaluation, the research impact evaluation of our cancer cell biology program at the UNC Chapel Hill. As you can see, there are two citation impact indicators here I used. One is field-weighted citation impact, and the second is RCR. As before the presentation, I briefly talked with Sharon that I always use one commercial software or indicators provided by the commercial package, and then use a freely available indicator together to show the picture. So field-weighted citation impact is the citation impact indicator provided for free by Scopus. If you have the subscription with the Scopus, you should be able to get it for free. But if you don't have Scopus, then this is not accessible to you. And then RCR score is the comparative citation ratio, the citation impact indicator provided for free by the US National Institute of Health. They developed a tool called iSight, and later I have slides showing you this tool. So they developed this tool to benchmark the citation impact or research influence of your publication with the average of NIH-funded publications. So they use this RCR score for research evaluation, basically. So using these two indicators, we can see they are above this 1.9 bar. And this bar shows the average citation impact of publications. And for this cancer cell biology program, all the publications, their citation impact is above 1, which means they are above the average. And on the right, this bar chart is from the paper that I co-authored with Allison. This is to evaluate, we use over 750 publications supported by our Translational and Clinical Institute at UNC, and see what's the citation impact of those publications. And we use the citation rank percentile. This indicator is also provided by Scopus. We can see that the majority of our tracks funded publications above the average 50 percentiles. And next is research collaboration. On the right, this visualization is like a flower. At the center node is a very distinguished scholar in the field of nursing. So this project was a request from a nursing school faculty. She wants to visualize all the collaborators of this distinguished scholar in her field. This is for her presentation in a big conference. So what I did is I went to retrieve all the publications that this distinguished scholar produced over her lifetime, and then analyze her co-authors. generate this visualization by using Citation, this tool, and Gathi. So the center node is this distinguished scholar, her name. And then each of the smaller nodes, they are her collaborators in her lifetime, over more than 150. So on the right is from this visualization is from the publication of that I co-authored with Allison. So we visualized how Institute supported internal collaboration, which means how UNC schools and units collaborated with each other. I color-coded each school with a different color so you can see the multidiscipline collaboration. For this collaboration networks, this is from a paper that I supervised my student. He's the first author here. And we analyzed a technology, used bibliometric analysis. We extracted grants data, publication data, and the patents data, and visualized to develop conversational interface, which has been used in healthcare, and who has collaborated with who in terms of research efforts. So we visualized all the affiliations, the institutions on this visualization. And on the right, this is the country collaboration visualization from a publication also I co-authored with my student, who is the first author here. And we use bibliometrics analysis to analyze the medical database widely used in the United States, especially in research enterprise. The originality of this project is the Trump administration shut down two very important medical databases that AHRQ, a federal government agency, created and has maintained. And the cited reason is the lack of funds and the lack of use. They think, the administration thinks nobody uses it, so the Trump administration said, okay, let's shut down these two databases. To prevent the further shutdown of additional databases, I told my students that let's do a study to analyze the impact of this important medical expenditure panel survey database to see how they have been how this database has supported the biomedical and the health sciences research. So that's the deliverable. This publication is the deliverable of this project. And we find out that although this medical expenditure survey database is supposedly, they have the data about all the medical expenditure expenses and the data collected from US households. However, this database has been used widely by the researchers all over the world. So US is the biggest user, but you can see many other countries, researchers from many other countries, they also use it. This definitely shows the impact. And here is the research collaboration also at the country level. This is the project I did last year for UNC Global Relations. They want to see UNC Global Relations has supported the collaborations between UNC and academic units in UK, Singapore, and Asian countries. So they asked me to help with the bibliometric analysis of their supported publications, showcase different the world landscape collaborations they have been supported. So this is the visualization I generated based on the publications they provided. And the last is the research landscape. This is also from the project I did with Allison for NC Tracks. We used more than 700 publications and visualize the different, visualize the title and abstract, showcase different areas of Tracks supported publication. Touch 4 different areas clearly shows that the mission of Tracks is to help the discovery from to actually create a pipeline from bench side to bedside. So to catalyze the research discovery in the lab and quickly applied to patient and the population science. So that's all about some examples I want to show. Now I want to quickly show you how to get started. Here is a list of all the research databases that I use on a daily basis, like PubMed, Scopus, and Web of Science, ACM Digital Library, and IEEE. In your case, your social sciences, you probably would like to use, I think I would highly recommend you to use Scopus and Web of Science, PubMed, depending on your topic. Another database you might want to consider to use is Academic Search Premier, and the other one is ProQuest. So depending on your local university's subscription, you can check with your librarian. And for the research tools, I would highly recommend the tools that I'm listing here. For Codance, it's a commercial tool, but you can create a free account for trial. It helps you for data screening, because for biomedical and health sciences, I manually screen each article I include in my study. But for many researchers in health science, in social sciences and humanities, they do not do screening, data screening. I think that's different standards and serve different purposes. For me, if I want to screen my data, screen the publications I want to include in my study, I use Codance to help me screening. And iCite is the tool I mentioned, which can generate RCR scores. It is free, and you can just Google iCite, and it was created by the U.S. National Institute of Health. It's free. For more information, you can go to the website and check it for yourself. Tableau is a very powerful data analysis and visualization tool. It's commercial. If your institution has the subscription, be sure to use it. And the Voice Viewer, for many of my research collaboration network visualizations, I created them by using Voice Viewer. It is free. It was created by researchers in Leiden University in Europe. And the Cite2 tool is a free tool, widely available. It was developed by a group of researchers in Indiana University in the United States. Be sure to check that. This is the typical workflow that I follow for my project. I first search all the publications. Sometimes the researchers or institutions, they provide a list of publications to me, but to get the citation accounts and the citation data, I usually have to use the information to provide it and go to citation database to retrieve them by myself. And then I will clean the data using either Excel or Refine or OpenRefine. By the way, OpenRefine is a free tool that you can use and download from internet. I think now it's called Google Refine. It's a data cleaning tool. And then you can, after your data is clean, data are clean and standardized, and you import data into a data analysis and a visualization tool to generate what you want. And the research process and the measures that you can report include in your manuscript and the publications. Usually that's how I included in my manuscript. I follow the, in biomedical and health sciences, we usually call it a Prisma diagram. So on the left is it's not exactly a Prisma diagram in this case because we have multiple data sources, but usually there is a Prisma diagram which has very high rigor in terms of data screening. And then depending on what you want to do, you may want to include a table for your metrics to list it clearly so audience can easily to follow along and know what you use to answer which research question or measure which issue. How to interpret bibliometric results? I think first of all, like I mentioned, not just use the citation counts, because citation counts will always go up for the group of publications you analyze. It counts accrue over time. Try to use comparative citation ratio, compare apples to apples. And the second thing is performance benchmarking. You need to know what you use to compare with. If you use the Scopus citation indicator, actually the citation, like a field-weighted citation impact and the citation benchmarking provided by Scopus, they compare your target group of publications with the average publications produced in the same field, probably in the same time, by the researchers all over the world. But if you use the RCR score, actually you are comparing the group of publications you want to analyze with the publications indexed in PubMed, supported by NIH funded supported by NIH in the United States. So you need to be aware who you compare with for the performance benchmarking. And the last, you want to ask yourself, can the bibliometric results answer the research questions? If not, what other data I need to get? Because citation bibliometrics can only analyze the public reported research activities in publications. For the research activities not included or reported through publications, bibliometrics cannot answer. So you may want to use additional research methods like an interview or survey to supplement the results. So I think I will just stop here and open to questions. So here are the works that I cited included in this presentation. And then I will leave the rest of the time for questions.
Thank you so much, Dr. Yu. We now have time for questions. If anyone has a question, you can unmute or type it in the chat. I am curious, I'll start while other people think of how to frame their questions, but I'm curious to hear a little bit more about how you approach you mentioned one of your examples was a publication where you used the keywords in the title or abstract. Mm-hmm. And so I'd like to know a little bit more about that process. And I think if I understand correctly, you did a network analysis. Mm-hmm. Yeah, and so I'm a little bit curious about the process for identifying the categories for the mm-hmm. topics. And then how you were able to classify different articles into one of these topics. And it looks like you have two levels of topics, right? You have the topics that are on the dots, and then you have kind of the classification above that. And I'm curious about mm-hmm. how you developed that process, those classifications.
I totally understand this question. This is a great question because I encountered this many times when I do my presentations. So, first of all, the workflow for creating this topic mapping network is to use you can use the title only, titles of the group of publications only, or you can combine titles and abstract together. Sometimes for some projects, I use author keywords because it's more concise and also it can get rid of a lot of noises. Sometimes I use mesh words. So it depends on the project and the research questions you have. And for this case, we used title and abstract of tract-funded publications. And I created this visualization using the software I introduced in Voice Viewer. So in Voice Viewer, there is a text mining function. In this text mining function, it automatically extracted the highly occurred terms in title and abstract. So counted their weight and also distance. Distance means how many times, how frequently this term co-occurred with another term. And then this tool will help you automatically generate a topic mapping like this. For the categories, there is a default setting of categories. Like in this category, they automatically using the default setting. The tool helped me generate the 4 areas which exactly relevant to TRAC's mission, from clinician's care and race, sex, and population. This is more like the population science, but also some categories, they are about the lab clinical disease and some drug discovery. So exactly cover the full spectrum of clinical and translational science. This is exactly what I want. So just to be clear, for this, this was the label I created by myself, but the color and the categories, I just created using the default setting of this tool. It's always difficult actually to give a category name, no matter what tool you use. So this is you can think about that and discuss with domain experts, especially sometimes when I do projects for other institutions. I'm not a domain expert. So when I generate this topic mapping, I always need to go back to the institution, talk with the researchers to make sure the visualization makes sense to them. And then they can give me suggestions, what labels, what a category or cluster labels are proper for each of the cluster visualized here on the for this visualization.
Excellent. So I think we have a question from Thomas and then Christina.
Okay.
Yeah. Hi, Dr. Yu. Thank you so much for your chat. I thought it was very clever to think about framing everybody's work in graduate school as doing bibliometrics. So thanks for that insight. My question has to do sort of with acquiring documents and bibliometric data.
Mm-hmm.
You sort of showed us at the beginning sort of like a point and click approach, and I was wondering if you knew or used any automated tools, or you could talk
Mm-hmm.
about automated tools in bibliometrics more generally.
Yes. So actually, there are multiple ways you can get citation data. You can directly go to Scopus Web of Science or using Google Scholar and using the existing user interface to retrieve bibliometrics data. That way, it's for us librarians, we usually construct very complex queries for researchers and try to exclusively to retrieve the data for them. You can also, now many databases, including PubMed, Scopus, and I believe Web of Science as well, you can retrieve metadata related to publications by their API. So this is more convenient. And also you can customize what data you want. And there is a toolbox PubMed provides called eUtility. You can Google that. So for PubMed eUtility, and they have tutorials and instructions on their website. It's like you retrieve PubMed data by API.
Sorry, how's it spelled?
Yeah, it's ABCDE and dash utility. Yeah, so if you are in biomedical and health sciences, or if you have a project you think PubMed will help, I would suggest you to use eUtility. Mm-hmm. And Scopus as well. If you have any difficulty retrieving data from the commercial databases, I think you are entitled to contact their help desk. I contacted their help desk all the time because we receive a request from our clients. And then because of the setting, the current setup of their database user interface, we cannot get the data for our clients. So I usually just contact their help desk because your institution pay the subscription, annual subscription, big money for that. You are entitled, you are entitled to get their service, So don't be afraid. Actually, they are very friendly and they usually respond clients' request in 24 hours.
Great, thank you. And Christina.
Thanks, Dr. Yu. That was such an interesting presentation. And of course, Michelle stole my question. I know where your head's at, Michelle. May I ask you to go into a little bit more detail, because this approach is new to me, on this research landscape and what you are already answering to Michelle. Would you be able to explain the text mining function a little bit more, and also how I think I was writing down notes as quickly as I could. You also mentioned weighting and how you were weighting these.
Yeah, this is related to the algorithms of algorithms of the package. So if you know, I'm not an expert in text mining. I'm more in apply the text mining methods to my project, so I can evaluate which tool can help me visualize the topic better. But what I know is majority of the text mining packages or tools or algorithms, they use the TF-IDF, which means for each of the documents, they get a weight. And then each of the words extracted from the document, some of the packages, they focus on the full text. weighting, which means they weighted each of the word in the full text. That's even more complicated. So in our case, especially in my research, I only focus on title and abstract because I think especially title reveals a lot what you want to do, right? You usually use very concise and accurate words in your title to reveal what you want to do. So when you group the title and abstract together, the software or algorithm will calculate, first of all, will delete all the noise, which means some stop words they will get rid of, like and or the, some unimportant words. Usually the text mining packages will get off, first of all, and then they will calculate the occurrence for each of the important words they extracted, which means you can manually set up how many times you want the words to appear. Like depending on the corpus of your title and abstract, sometimes I have thousands, more than 1,000 publications. I would manually set up the occurrence rate is high, like only show me the keywords, the key terms, extracted key terms occurred more than 10 times or 15 times. But that you can manually adjust it. If I only have 100 documents, 100 titles and abstract, I may set the rate lower, like only show me all the key terms that occurred more than 3 times or 4 times. So for this part, you can manually adjust. There are so many text mining packages and algorithms now available. So for this case, I use Voice Viewer. And recently, I'm trying another package called the Biblioshiny. Biblioshiny spelled as Shiny. If you go to YouTube, they have some instruction videos there, accent instruction videos there. I will send the information to Michelle maybe later after the presentation. So each of the packages, they use a slightly different algorithms, but basically they use the LDA, some like Python also has some very similar text mining functionality you can use. Although the algorithm is like a black box for us who are not expert in text mining, but one thing we can do is try different tools to see which one can best represent this group of publications that I want to analyze. And then, so many of them, they calculated the weight for each of the keywords they extracted, and also calculated the weight for associated words, how they associated together, co-occurred together across documents. So if you are interested in knowing this, you can go to Voice Viewer, the website. They have a menu, and they explained, not in great detail. They don't want to tell you. They have several papers about the algorithm, like Levine algorithm behind how they generated the networks. You can read additionally, but on the website, the menu is just teaching you how to use it. And as I said, for many algorithms now, it's like a black box. It's not that transparent. So for us users, what we can do, because it's so quick, you import the title and abstract, immediately you get the visualization. So we can try different tools to see which tool can help me answer the research question I have. I have another paper I submitted to a journal recently. I compared Voice Viewer and the Biblioshiny. I find that Biblioshiny actually generates the keywords mapping actually makes more sense than Voice Viewer. So not one tool is universal. We have to use it, every time. Now the tools, there's so many. Like me, I'm always learning and always would like to try, or even combine different tools.
Can I ask you one follow-up question on that? Just because that explanation was fantastic and it makes sense to me. But if I were to apply this to the field I work in and using something like a title, I can see some limitations there just in terms of the range in terminology that's used worldwide and internationally. And so I'm not sure that that would be an accurate representation and that I would be
Mhm.
missing.
You can totally manipulate that later by yourself. In Voice Viewer, you can do that. In BiblioShiny, I think that's a limitation of this tool. In Voice
Okay.
Viewer, if you think confidence interval, like on this visualization, if you think this is not the term that widely used in your field, you can manually change it. It's very easy if you just follow the. So you can actually using a thesaurus function to utilize several terms that you think, yeah, people use differently, but actually they should be called as a standardized term. You can manually change that and then re-import it into the software, and then it will visualize with the term you want.
Fantastic. Thank you.
You're welcome.
Thank you. And Reagan, I believe you're next.
Okay, perfect. Thank you for your presentation. I just have a couple of questions.
Sure.
So the first one, I just wanted to hear more about the systematic review where you manually go through all the articles in your sample size.
Yeah.
In terms of like the, like how, like if you're dealing with like thousands of articles,
I know.
is there a way to?
Yeah, it's so hard, right? And systematic review is a big service area in my library. And I also support my the students and faculty in my health informatics program for systematic reviews. Manually screening is always tedious and time consuming. What you can do now, also highly recommended by Cochrane Systematic Review Committee, you can use some automated tool to serve as the second reviewer. So now there are so many automatic tools you can use to facilitate with the screening, but the current agreement in the Systematic Review Committee is none of the tool can completely replace human beings manual screening. To make sure the correctness and the objectiveness and avoid bias in selecting studies, it's strongly recommended at least one human reviewer should be involved in study selection. And then you can supplement with automatic tool. There's so many. You can Google the Cochrane Systematic Review handbook. In the handbook, there are several automatic tools recommended by this community. And I did a usability testing of Confidence, this Confidence software, with another AI enabled systematic tool called Colander. Colander is a new tool compared to others. There are additional systematic review screening tool like Distill SR is commercial, so you need to pay for that. But Colander is free, and there are several others. You can just Google systematic review automated tool. You should be able to find several ones. I just want to tell you, based on my usability testing, we find so far Confidence, this software, which does not have AI function, you still need to go through all the manual screening and the study selection, but it has the best usability. I have to say, it's very easy to use, can facilitate multiple reviewers to work at the same time. So I would say you can use as a human reviewer to use Confidence, and then if it's a student project, I think it's perfectly fine to supplement with the AI tool to help you screen and serving as a second reviewer. So then that gives you some rigor to your systematic review study.
Thank you.
You're welcome.
And I just have one other question. It was in regards to the RCR, the one where you compare papers.
Yeah.
So I just wanted to hear a little bit more about it in terms of, I guess, how it interacts with like impact factors and if there's
Sure. So iCite, which is the research tool I listed here, the second one, iCite is different from the other tools like the tool Scopus, and Web of Science also provide comparative citation ratio. These are the three most, at least me, I have observed over the recent 3-4 years appearing in publications. So for the eyesight, if you go to eyesight website and they list all the publications that they have in terms of validating this tool. So eyesight is validated. The first paper about this validation, RCR score and eyesight, this tool was published in PLOS, PLOS1. So that's a very good paper. This tool was first developed by the NIH Office of Portfolios. And this Office of Portfolio, they are mostly to help with portfolio assessment and performance assessment evaluation of NIH-funded research activities or funded research projects. They need some tool to help them to see the citation impact or research influence of their supported projects. So that's the originality of this tool. And what the limitation of this tool is, I think last year they have a totally like a renovation about this tool. Before, eyesight used the citation data, I believe, from Web of Science. But you know, when you are a federal government agency, you use the vendor's data. That's somehow, you know, it's not that great because you have this dependency. So since NIH has an excellent treasure, which is PubMed. PubMed is one of the largest citation database and abstract database of the literature in biomedical and health sciences. It's used daily by researchers all over the world. It's free. And it, personally, I think it's the biggest asset of this country, of the United States. So eyesight did a very smart move. They didn't they stopped their collaboration with Web of Science. Instead, they directly connect the eyesight tool with PubMed database, which means that all the citation and citation records and the citation information directly connected with PubMed. Why PubMed, you know, index so many publications? It's because every NIH-funded publications supposed to submit a full text article to NIH. Because I provide funds to you, you're supposed to provide the full text of your manuscript when it's published back to me. So that's they call the NIH compliance policy. Because of policy, so NIH has pretty much all the full text manuscripts, and including the citation and abstract data of those compliant researchers. So it grows very quickly and grows very large. So this eyesight create a score called the RCR score, compare the citation counts of your article with the citation counts. They calculate the average of NIH-funded paper because that's the data they have. How many papers, research projects that NIH supported, that data is directly available for NIH researchers. So that's why they have the data, and they calculate the average, and they provide you with your citation. So that's why they use an algorithm to create an RCR score to compare your citation counts with the citation counts of an average NIH-funded paper. So when you use eyesight, actually you are comparing your publication with NIH-funded paper. This might not be that much of value to you because unless you do want to compare a group of your publications with the another country like United States federal government funded paper. Unless you want to do that, I would recommend you, since you have Scopus actually compare your paper with the average citation impact with the researchers from all over the world. So it's a much broader scope because of Scopus have the capacity to do that. It's the largest publishing company in the world. It has headquarters all over, different countries. So, but the eyesight is free, and Scopus database, your university has the subscription. You have access to the data. And so in my study, our UNC have a subscription to both Scopus, Web of Science, and for eyesight it's free. So sometimes I think most of the time I use Scopus and iSight, not Web of Science, because for Web of Science, still, because of a subscription is only to the core databases, I do not have access to their comparative citation ratio that Web of Science provides, so I cannot use it. So these are the caveats when you explain your bibliometrics results. You need to clearly state what citation impact ratios that you get from where, the source. And then I always include one commercial indicator and one I grabbed from free resources and together to show the picture. So to avoid some bias, you know.
Thank you. That was
You're
helpful.
welcome.
Well, we're coming up on 11:30. So I'm going to take this opportunity again to thank you, Dr. Yu, for sharing your insights with us on bibliometrics and how we can use it in our research in the social sciences. CRESS will be having these talks. Our new time is Fridays at 10:30 a.m. For the fall term. And so we will be back here next week with another talk, and I invite all of you to join us then. And in the meantime, thank you again, Dr. Yu, and I wish everyone a lovely extended holiday weekend this weekend.